Good morning. I'd like to start by acknowledging the Mi'kmaq territory, the lands on which we're meeting today. As Sam, geez, sorry, I get a little nervous up here. As Sam said, I'm from the Canadian Aboriginal AIDS Network, and like Julie, I'm a bit of a jack of all trades and master of none, so I'm going to talk about a couple of projects that we have on the go at CAN. And I'm also coming from a different perspective, that of the national, but I'm trying to focus the work, because we do work in the Atlantic provinces as well. So CAN is a national organization that works with the Aboriginal community, First Nations, Métis, and Inuit across the country from coast to coast to coast. So, as you can imagine, that's a lot of territory to cover. My personal, I'm a community-based research manager with CAN, and the people that I work with are from Ontario, East, and including Nunavut. So it's a lot of ground to cover by one person. We have two main offices, one in Vancouver, that's where our programs work is mostly done out of, and in Cole Harbour, across the pond here, we have the Research and Policy Unit, which is where I'm based, and most of my research colleagues are based there as well. So we're a national, but we're small. We have 4 staff in the Research and Policy Unit, and we have 5 program staff. So that's a lot of territory, as I say, to cover for a very small group of people, and we're quite spread thin. So I guess that would be one of our challenges, right? We do work with Aboriginal AIDS service organizations across the country, so we're not really a frontline organization. We do programs and policy and research work. At the Research and Policy Unit, the focus of our research that we've engaged in so far, and it's always growing and expanding because there's so many issues that need to be addressed and that are, interesting and that need to be addressed. So we look at the needs of unique populations within the Aboriginal community. We've done work around care, treatment, and support, access to care, mental health issues, substance use, housing, family, youth, women, and so on and so on and so on. It's the breadth of what we do is quite extensive. In the Atlantic region, I've been really fortunate to work with Julie and Alana and Lois on a project with Barbara Patterson, looking at the implementation or the understanding of JIPA and MIPA in rural ASOs across the maritime, well, not Newfoundland, but in Nova Scotia, PEI, and New Brunswick. That's been a really great project. I've been mostly engaged in the photo voice component of that work, which has been really interesting. We partner very closely and work very closely with Healing Our Nations, and I know that there were supposed to be people from Healing Our Nations here today, and like us at CAN, they're quite stretched thin, so unfortunately they have to send their regrets. One of the projects that I wanted to talk about is it's a project about housing in the Aboriginal community, looking at the housing needs for HIV positive Aboriginal people living across the country. So we've got four sites that we're hoping that this is a pilot. It's a 3-year project. It's a 3-year operating grant, but we're hoping that eventually we can, sort of scope it out past just the 4 communities that we're working in. So in the Atlantic, we're based in Fredericton. We are in Regina, Victoria, and Toronto. Those are our 4 sites. So we're working with Dr. Sarah Green with McMaster University and Renee. They're the co-PIs on that project. And basically, we're doing a scoping review of policies across the country that pertain to housing and Aboriginal people in particular, just to see what's out there and get a read on what's going on. And then we're also hosting 4 workshops in the 4 sites that I've mentioned with Aboriginal people who are living with or affected by HIV. And they're going to be creating digital stories, which are 2 to 5 minute personal narratives using photos and video and your own voice, your own story. So we're getting these individuals to share their story with us about housing and some of the challenges that they faced, and we're hoping that those stories will then be able to be sort of woven into the policies and policy changes that we're hoping that will be yielded from this project. The other, and we also have hired the really exciting, well, there's many exciting things about this project, I think, but one of the really exciting things about this project as well is that we've hired 4 peer research associates, and we have one based in Fredericton, so each of the 4 sites have a peer research associate, and they'll be helping us make connections with the community, and we're hoping, contributing to their skill set as well, and so on and so forth. So we met as a team 2 weeks ago in Toronto, I think, and it was a really amazing group of people, and the peer research associates in particular they're budding leaders, I can tell you that for sure. At CAN, we don't really talk about harm reduction. We have to use a different language, I guess, thanks to our government, but we talk about risk reduction and community readiness. So one of the big projects that CAN is involved in right now is the community readiness work that we're doing. And that model basically helps communities assess how ready they are to address the issues of HIV by integrating culture, community resources, and the level of readiness to more effectively address a particular issue that's happening in their community. And then, so the way that this whole process is set up, it's basically in 2 parts. There's community members who are brought together for training, and they're taught how to implement this model into their own communities. They're introduced to the models and the strategies that can be used to implement this model. And then they're sent home with the knowledge and skills that they've had, and they are they train their community facilitators in their own communities. We've recently, I guess, this is a project that's led by Monique Fong, one of my colleagues, so I'm kind of, she coached me on this last night, actually. But we've recently integrated another step into this model, and that is basically when facilitators need support or helping to implement some of the strategies and so on, we're willing to do that. Before, I guess, previously they were just basically given the information, given the training, and then left to their own devices, but we're actually, CAN's building into that program the support for those people in those communities to do the work that they're doing. One of the stories that Monique wanted me to share was that there was this woman who participated in one of the projects in Quebec, and she was new to HIV work. I think she was a younger person as well, and because she went to this community readiness training, she felt compelled and confident enough to enter a contest that would develop an HIV prevention video. And I'm not sure if she won, but that's not the point, right? Like she had never engaged in this work before, and she was, stepping out as a community leader and someone who was interested in sharing messages of prevention and so on. And if you want to learn more about that program, Monique Fong and Ed Bennett I can put you in touch with them at CAN. And at this point, there have been 12 community members, I think, brought together. 100 people, I know Monique said at one point or another in the past few years, have been integrated into this work. So my intention when I was invited to do this was to have one of the members of the CAN Youth Council come up and speak to youth issues and the work that the Youth Council at CAN are doing. Unfortunately, she wasn't able to make it today. So as we were doing the fishbowl earlier, I was thinking about, I'm involved as Jackie is in the REACH, and we have the Aboriginal program for research, and at our last meeting, we invited Jessica Danforth, who will be here tomorrow. She's the coordinator of the Youth Council for CAN. So if you have questions about youth leadership, she will be more than happy, I know, to talk to you about that. But we invited Jessica to our meeting, our last one that we had. Oh dear. Just to fire one. Okay. Well, so Jessica was invited to talk about what youth needed to, how could we better engage youth in CAN and in the organizations that we work with. And I think that we've heard a lot of the things that Jessica brought to the table, but essentially no tokenism, right? And mentorship, like figure out what skills you have that you could offer to youth. And when you invite them to be part of a research team or part of a committee, bring them in as equal players, as someone who has the experience that they have and can bring and contribute to your project or whatever in a really effective and positive way. Because if we're talking about engaging youth, we have to bring youth to the table and give them that opportunity to share what they have. And the arts-based stuff too. I'm working with Sarah Flicker's Taking Action project, and that's been an incredible, just an incredible project where youth have really taken the leadership role in the work that they're doing. And yeah, so that's all I'll leave you with for now. Thank you.